to begin, its communication is a key component of patient care. As the world population grows, the patient population is becoming more diverse and care of non-English speaking patients is becoming more common. A diverse patient population and limited bilingual healthcare providers creates language barriers and challenges with patient-provider communication. The different technological tools that can assist providers with translation and communication in a patient care setting, as well as implications for using such technology in the nursing profession, can differ. Technology plays a key role in the ability to communicate effectively, and by exploring and critiquing different technological options for interpretation while considering cost efficiency, effectiveness, and improved patient outcomes, the Stratus video we've determined is the most effective for positive communication and quality change. Thank you.
Stratus video is an interpretation system that allows communication between parties through a video phone that is available 24 hours a day, 365 days a year. The benefit of this system is having that face-to-face interpretation on demand through a phone interpretation system. The system eliminates the language barrier to provide effective and safe patient care. The interpreters have at least 1 to 3 years of professional interpreting experience and hold certifications. All calls are encrypted and private, which comply with the current HIPAA laws, and there's multiple languages available. A major problem that hospitals face in providing language services is that they are costly. The average U.S. hospital spends nearly $1 million a year on language services. And although these services are available, they are often underutilized because they are difficult to access, leading providers to sometimes communicate with limited English proficiency patients using methods such as hand signals, informal interpreters like patients and family, or their friends. According to the CEO of Stratus, Sean Bellinger, the cost of languages services pale in comparison to those associated with malpractice suits due to language barriers. Stratus video can be uploaded onto any PC, Mac, smartphone, or tablet. The technology can even be applied to Polycom and Cisco systems. The call connects with the available interpreter at one of the call centers, and it uses a private network for HIPAA compliance.
While there are many interpretation options available in hospitals, such as Sericom or Blue phones, face-to-face professional interpreters, and family members, there are negatives to each of these options. With the Sericom phones, they're clunky and not user-friendly. Oftentimes it can take up 2 to 3 minutes to get someone on the phone, which can obviously delay care. Professional face-to-face interpreters are hard to come by in hospitals. Oftentimes there's only 1 or 2 on a shift for a whole hospital, which obviously delays care as well. And family members have bias. Unfortunately, oftentimes when using a family member, you don't know that they're giving the patient the exact interpretation of what you're saying due to the fact that maybe they're trying to pull a certain type of response from that patient, or they're not liking what you're saying, so they're going to say it differently. Due to these negatives, Stratus, the video interpretation, is a better option. It's more user-friendly, it's quicker. Oftentimes you can have someone on the line as quick as 30 seconds after you bring the machine in, and there's no bias.
After carefully reviewing the potential methods available for interpretation services in healthcare, we decided that Stratus is the most efficient, effective, and cost-friendly method. Stratus is shown to improve patient care as well as reduce the costs associated with interpretation services. Stratus also uses a face-to-face technology, which allows for the interpretation of verbal as well as nonverbal languages such as sign language, which is so important. There are many implications on nursing regarding interpretation services. One of the most important is the fact that us as the providers are ultimately responsible for ensuring that all translation and communication is accurate. For this reason, the interpretation services being used must be trustworthy, reliable, and available at all times. Stratus guarantees that all of their translators are certified to translate in the healthcare setting as well as available for interpretation at all times. Another thing that is very important is the fact that interpretation services greatly impact the nurse-client relationship. This can be positive or negative depending on the translation services that are being used. Face-to-face, as used in Stratus, leads to greater trust and easier conveying of emotions in speaking. This is very important for the patient as well as the nurse. When patient satisfaction with interpretations improved, it improves nurse satisfaction as well. Implementation of Stratus will affect nursing in a positive way. It will improve satisfaction and care for patients as well as nurses.
It is said that nearly 9% of the United States population experiences a sentinel event or an adverse event related to a language barrier. This is according to the Agency of Research and Quality. There are many pros to using the Stratus video interpreting system. The Stratus interpreters are medically certified interpreters, and they can process 40 to 50 calls in a 4-hour period, and they work 4 to 5 hours per week and can handle 160 to 200 calls in a week's time. This is much more than a typical on-site interpreter who can only handle 40 to 80 calls per week. So this is pretty significant in the fact that they are so readily available and they can cover more ground than a typical on-site interpreter. They also can speak 175 languages, which is great when you have a language that isn't really common to the area. You never know who's going to be visiting from another country, and the Stratus is there to cover that language. They also connect within 30 seconds, which is an amazing feature because not always interpreters are on site, so you have to call them in and wait for them to arrive, which can hold up care. So this is readily available and can help in an emergency situation.